Hi everyone, welcome to Medicine A to Z by Dr. Lenard. In today's video, we'll be discussing anal fissures, what they are, symptoms, treatments, and more. If you find this video helpful, don't forget to give it a thumbs up and subscribe to the channel. Anal fissures are one of the most common benign anorectal diseases and a leading cause of both anal pain and anal bleeding. Anal fissures most commonly affect infants and middle-aged individuals. Patients with acute anal fissures typically present with severe anal pain, especially during defecation. This pain may last for hours afterward and is often associated with anal bleeding. Acute fissures have symptoms lasting less than 8 weeks, while chronic fissures persist for more than 8 weeks. Anal fissures cause severe pain, especially during defecation, and may lead to anal bleeding. Hemorrhoids, on the other hand, cause discomfort, which is usually milder unless there's a thrombosed external hemorrhoid. Internal hemorrhoids are typically painless, but can still cause bleeding. Acute anal fissures look like fresh, superficial lacerations, similar to a paper cut. Chronic fissures have raised edges exposing the internal anal sphincter fibers, and are often accompanied by external skin tags and hypertrophied anal papillae due to chronic inflammation and fibrosis. During the first-time exam, avoid invasive maneuvers to prevent worsening the pain. Position the patient in a prone jackknife position. Then gently spread the gluteal cheeks to inspect the posterior midline. Visualization of the fissure may be possible in thinner patients. Anal fissures are suspected based on a history of anal pain triggered by defecation, often lasting for hours and usually associated with anal bleeding. Diagnosis can be confirmed by physical examination with a direct visualization of the fissure, especially in thinner patients, or gentle digital palpation of the midline to reproduce the pain. Preventing anal fissures involves avoiding both diarrhea and constipation. Maintaining healthy bowel habits through a high-fiber diet and adequate fluid intake helps prevent straining during defecation. First-line treatments for anal fissures include fiber supplements, Sitz baths, topical analgesics like 2% lidocaine jelly, and topical vasodilators such as Nifedipine or nitroglycerin for 1 month. For constipated patients, a stool softener or laxative should be added. First-line treatments for anal fissures include fiber supplements, Sitz baths, topical analgesics like 2% lidocaine jelly, and topical vasodilators such as Nifedipine or nitroglycerin for 1 month. For constipated patients, a stool softener or laxative should be added. To manage anal fissures, 2 effective topical treatments are topical Nifedipine, helps reduce anal sphincter pressure. Topical nitroglycerin promotes healing by increasing local blood flow and decreasing pressure in the internal anal sphincter. Looking to boost your fiber intake? Here are some high-fiber options to add to your diet. A medium apple with skin has 4.5 grams of fiber. A banana provides 3.1 grams. Oranges also offer 3.1 grams of fiber. 1 cup of green beans contains 4.0 grams. A medium baked potato with skin delivers 3.8 grams. For a fiber-packed meal, try a cup of baked beans or kidney beans, each with 13.9 grams. Brown rice has 3.5 grams of fiber per cup. Aim for 20 to 35 grams of fiber daily for a healthy diet. Surgical options. If medical therapy fails, surgical options can be considered. High risk of fecal incontinence, botulinum toxin injection, fissurectomy, anal advancement flap, low risk of fecal incontinence, lateral internal sphincterotomy. Effectiveness. Heals over 95% of fissures within 3 weeks. Comparison. More effective than topical nitroglycerin, botulinum toxin, and oral nifedipine.
Stay updated with the latest in medicine. Subscribe to our channel for comprehensive videos covering the latest updates in the field.